My name is Lena Vakil. I am currently a director and principal at a practice called William Place Dental Aesthetics, which is based in Bow, East London. I have been here for the last, over 10 years actually. We started this practice back in 2009 and I have been working here ever since then. It's a 9-chair practice and we are very much well embedded into the community here. We've been here for quite some time. We know a lot of our local practitioners and doctors, dentists, and also pharmacists, a lot of the healthcare professionals. And we have a lovely large team here. I decided to become a dentist partly because my father was a dentist. And so I used to enjoy traveling into his dental practice and doing some part-time work, sometimes being a receptionist, sometimes helping him and his nurses as well. And I just like working with patients, actually. That's what I enjoyed. I liked doing something that was very practical. I was never really someone that wanted to just sit at a desk. So I enjoyed the fact that dentistry is very vocational. So it's something that has a bit of everything. So you are interacting with patients, which I love doing. And actually you can be yourself with patients. You don't need to necessarily just have a fixed way in which you speak to patients or do things. And it's very varied. So with dentistry, there's a lot of personality involved. It is practice, as I mentioned, so you could actually decide on different aspects of dentistry. You didn't need to necessarily decide on any one particular thing that you wanted to do. When I qualified, was very fortunate that I was chosen to do a house officer position in my own university where I graduated, which was a great privilege because it gave me the opportunity to work and enjoy oral surgery, which was something I enjoyed. And that's what led me on to enjoy this particular specialty. So I continued working for a year in the dental hospital there as a specialist in oral surgery at that point. And I was open to seeing the different areas of oral surgery and what could be available really for someone. I decided to then continue with that and work in the hospital system for another four years. And then I was also offered to work abroad actually in Sydney, Australia. So I worked there, which I really enjoyed because actually I could use all the skills and the qualifications that I developed in my young training days and work in Sydney actually, which I really thoroughly enjoyed. So I then just loved the specialty of oral surgery, which I continue to do alongside the general dentistry. But I focus a little bit more on oral surgery for those further years, which I'm still doing now at the moment. I enjoy working with patients, actually. I think that's one of the things I really enjoy because I find that every patient is very different. Every situation is very different. I have chosen the specialty of oral surgery, which tends to be something that makes people feel very anxious and worried about. It's not the routine dentistry that you have. And I find that you need to really get to know your patient. You need to be able to speak to them on a very sort of a very down to earth level, actually. I think one needs to really understand what the patient's actually going through. I often see patients and they've been referred to me for treatment, so I don't have a lot of opportunity to get to know them or build rapport. So I do need to learn how to do that and work with patients very quickly, which I feel I've actually been able to do quite well, as I've had lots of lovely feedback from patients and I enjoy it. And I think when I'm actually doing my work, I really enjoy getting that feedback from them and also knowing that they feel comfortable to work with me. Now, one of the things I also did was when I was working in general dentistry, whilst I had a really great interest with oral surgery, I felt that actually there was another avenue that I could explore, which was that of implant dentistry. And that was really good to use my surgical skills that I developed over the years with also the background of general dentistry, because often I'd see patients that were referred to me and they would say, oh, this tooth is being removed. What can I do later on? Have you got any options or any things that you could advise? And having had that experience of general dentistry and the oral surgery, I felt I was very well placed to be able to give them a really comprehensive understanding of what would be involved, which is where then I decided to expand my skills and work in the field of implant dentistry alongside oral surgery. So I have completed quite a few courses. I did the diploma of implant dentistry at the Royal College of Surgeons. And I think with dentistry and oral surgery, you need to always keep updating, keep yourself ahead of the advancing, the skills that are constantly being improved and different ideas that are out there so that you can really offer and give the best to all your patients, really. So I think that properly now, I feel I'm able to really give patients a very broad and comprehensive explanation of what might be involved, not only in oral surgery, but also in that area of implant dentistry. I think honesty is the one thing. I don't think I let the patient sort of know where and how their treatment's going to, and how it's going to be carried out. I think I'm very honest. I try to be as jovial as possibly can with patients. I think, as I've said earlier, I think it's a very nerve-wracking experience to go through. A lot of people don't like coming to see the dentist. That's a well-known fact. Very, very nervous about coming to see us. And often I have patients saying, "You're the worst person. I don't want to see you, really." And I think it's nice to have a little bit of joviality. I think it's about bringing the patient into a comfortable environment. I think that's the most important thing, because actually if the patient has the confidence in you and they understand that you understand what they're going through, that actually means that you have just a very nice symbiotic relationship, so that you can actually do the treatment you require, that what's needed to the best abilities that I know I can produce for the patient, and also to give them the best outcome that they would want. So I think that, I would say, honesty and actually being truthful to the patient is very important, because I think I try and put myself in the patient's shoes. What would I want if I was going to see someone for an opinion or an explanation for a treatment? And I think that's what's really important. So they don't feel that they are worried to ask any question, be that often patients will say to me, might be a very silly question that I'm asking. It's never a silly question. It's about knowing that actually everything is being answered for them, so they know what their eventual treatment plan is going to be, and how they're going to be able to manage that as well. And actually, not only the patients, it's also about the families. So sometimes actually you do need to explain to them that actually, you need to have that backup or people that can help you with that as well. So we often give patients a lot of information so they can explain that all to their families. They're also going to be taking part in their journey really with us. I value equally honesty from my patients. I think when you're carrying out treatment for anybody, it's important that actually you understand what the patient really would like to have in terms of their experience with you. I think engagement in terms of the overall treatment. So, for example, like I say, I treat a lot of patients with oral surgery. So when I've done my so-called work and I'm finished with whatever treatment I'm doing for them, I really would like to know that they're also invested in looking after themselves afterwards, because my part of the treatment is only part of the treatment. It's the aftercare that's also important. So I think it's very important that they are able to look after themselves afterwards. Also that they're able to look after themselves beforehand. So often when I'm seeing them, I try and ask them, how they can prepare themselves, which is part of the consultation. Just, what things you need to do beforehand, what you might need to do afterwards, work-wise, family-wise, how you can look after yourself. And more importantly, I think as well in the areas of implant dentistry, I think it's that upkeep and maintenance, because often when you're providing implant dentistry, you are providing a tooth for the patient or something that they can now chew on and use permanently. But the treatment doesn't stop when they leave the surgery. The treatment's ongoing. So it's all about that continuous care, the upkeep, the management, and actually being confident that they can always come back and speak to me. Ask me for things, they can always come back and see our team. We've got a great team here that can look after them. So it is about knowing that you can support them as well afterwards. And the journey doesn't just stop when they leave the surgery. It's ongoing, it's continuous.